Well, of course, we've been looking forward to the holidays all year long, but this year now with the Omicron variant going around, doctors say it is not a time to let your guard down. Our Logan Gay shares what you can do to keep your friends and family safe while still preserving your holiday traditions.
You may be ready to deck the halls with your close family and friends, but as you prepare to pass out your gifts, the CDC wants to help you avoid passing on something else. Because the Omicron variant spreads easier than any other COVID strains, a simple dinner with family and friends can be all it takes to get sick. That's why the CDC says if you're planning to be around a large group of people over the holidays, the best thing you can do is get the vaccine or booster beforehand. And add an extra layer of protection by getting tested for COVID-19 before and after the event.
If you test in the afternoon before coming over and everyone is negative, yeah, then I think you can relax.
And if you're in an indoor public setting like the grocery store or even serving food, make sure you wear your mask. And don't forget, fresh air is important. Make sure you avoid poorly ventilated areas and open a window or a door to get some airflow. Also consider the potential risks to new babies in the family and maybe keep a little extra distance.
I would take additional precautions because this is an infant that we're talking about with very little immune protection.
This year, consider assigned seats. Seat members of the same household together, and if possible, leave some distance at the table for members outside of that household. And of course, wash your hands frequently and have plenty of hand sanitizer available.
Well, the hope is that by playing it safe this holiday weekend, it'll save hospitals a lot of hassle by avoiding new cases and hospitalizations. Right now, they're already overwhelmed to the point of calling in help from FEMA. Today, we'll get an update from IU Health about Navy military members assisting at Methodist Hospital. But the need is not limited to Indy. Capacity levels are critical in several small communities. Hancock Regional Hospital is maxed out with every bed full, and half the patients are COVID positive, and nearly all of those people are unvaccinated. With hospital workers spread thin, they're now postponing many elective surgeries because they've run out of room.
We postpone surgeries every week, and there are some that we cancel and just have said we're not going to be able to do this until we're through this surge.
Well, state health leaders say that there are almost 3,000 COVID patients in Indiana hospitals right now. This is similar to what we saw this time last year before we had widespread access to the vaccine. So hospitals fear that things could get worse in the coming weeks with the Omicron variant spreading and holiday gatherings. And that's why they're pushing everyone to get the shot and again, play it safe this weekend. Meanwhile, the FDA just granted emergency use to Pfizer for the first pill you can take at home. It's called Paxlovid, and doctors can prescribe it to anyone ages 12 and up. However, priority will go to those considered high risk, people most likely to get severely ill, and that's because the initial supply will be extremely limited with enough to treat about 10,000 people. Now, the White House has ordered 10 million treatments.
We will have 265,000 treatment courses of Pfizer available in January, with monthly totals of pills ramping up across the year, and all 10 million treatment courses delivered by late summer.
The pill will need to be taken within 5 days of symptoms in order for it to be the most effective. You'll then have to take 3 pills twice a day for 5 days. Pfizer has said that this pill should work against the Omicron variant, which is now in all 50 states. The FDA is also reviewing another pill treatment. It's from Merck. The agency's advisory group voted narrowly in favor of recommending that drug last month. And just a quick reminder, Omicron appears to be milder, at least for those who are up to date on their vaccinations. But you still need to keep in mind the symptoms and take it seriously if you notice you have them. The top 5 symptoms, we've heard them before: a runny nose, headache, fatigue, sneezing, and a sore throat. Well, the Supreme Court announced that it would hear arguments on President Biden's vaccine and mask mandates during a special hearing on January 7th. 2 of President Biden's initiatives aimed at addressing the coronavirus will be assessed there as well. One requires large companies to have their workers get vaccines or be tested weekly and wear a mask. And the other requires healthcare workers who are employed at hospitals that receive federal aid to be vaccinated against the virus. The court said that the enforcement of the OSHA regulation for large businesses and healthcare workers will remain in effect until those arguments are heard.